By now, you've all heard of the TV show Heated Rivalry, which has already become a cult hit around the world. The author of the book series the show is based on, Canadian novelist Rachel Reid, says that she's been on a 5-year waiting list to see a specialist for Parkinson's disease. But now that she has acquired some fame, she's getting an appointment in 2 weeks. That prompts us to ask this question. Do you need to know the right person to get health care in this country? Let's go to Paul Brunet, patients' rights advocate, president of the Quebec Council for Patients' Rights. He's on the line. Paul, welcome back to the program.
Good morning.
And for you and our listeners' sake, I should mention this, right? So Rachel Reid, this author, did an interview with Variety, the big Hollywood magazine, and there she mentions that the guy that directed the TV series was on CNN. Jacob Tierney is his name. He's on CNN. He does an interview. He mentions that Rachel has Parkinson's and is on this waiting list. Boom, she gets contacted by someone, a doctor, and now she's going to see a specialist in 2 weeks. Paul, do you need to know the right people to get the proper care in this country?
It at times helps, of course. I mean, this has been going on for, you have enough experience of life that popular, famous, or rich people always get in front of the line. This is not new. I mean, have you ever heard of, pop stars or very well-known politicians waiting at emergency ward to get an appointment or get a consultation?
Mm-hmm.
Not at all.
Yeah.
I was just thinking of the exposition on the Titanic I saw recently, and you could see, who died among the people who were registered as people on the boat, and the most numerous number of deaths was with people living or having a room downstairs in the boat. Upstairs with the very pricey room, most of them survived, or a lot of them survived. So this is not new, unfortunately, but what is more scandalous is that this lady or any other person who needs faster attention from a health specialist is not getting it with the billions of dollars of income tax we pay every year. This is the scandal to me, anyway.
Yeah. Well, listen, Paul, in my mind, I think we like to throw shade a lot at the U.S. system, and I think we see the disparity in the U.S. system, the haves and the have-nots in the U.S. system, and we like to say, we're better than that. But it is distressing to hear, no, this is in Canada, where you need to know the right people at times to get the proper care. And as you mentioned, we pay billions of dollars into that system.
Listen, I'm not known, but I was waiting for an operation of my 2 knees, and the specialist came to me. Oh, Mr. Brunet, yeah, you work for patients. We're gonna make you pass. I said, no way, sir.
Oh, wow.
Put me on the list, and I'll wait. Don't you try to make me pass in front of everybody. So I waited a couple of months, and finally I was operated at Chateauguay, which went well, but. And I'm not famous, but some doctors know me.
You're well known, and you represent patients, right? Yeah. So you're. I would imagine there are people in the system. Oh, we don't want to upset Paul. He's going to talk about us, right? So I get that. How do we fix it, Paul? Is there a way to a more just system?
Oh, that's a good question. We need more doctors. We need a better efficiency of the system. I know it can be done. I mean, in some northern countries in Europe, it works much better. And we're very bureaucratic. I heard that Santé Québec wants to, make some changes in terms of how many people we have in the offices, whereas we need more people treating patients and more availability of resources to treat patients. This is a health system. This is not a bureaucratic system. So they're working on it, apparently. I hope they're going to do the best job they can. But until then, we need some more efficiency. Even doctors are talking about more efficiency, and they're ready to do it, some of them anyway. And I hope that the accord recently signed by the Tamoque and the minister will help patients having better access. We're talking about more or less 500,000 orphan patients who should be registered in a CLSC or one of those private clinics, GMF there. so that they get appropriate care. But it's a lot of work, and unfortunately, some people pretend that I'm critical, but who is critical if I'm not criticizing the system?
We're with patients' rights advocate Paul Brunet. So, Paul, let me ask you this, because you brought up how they do it in some European countries. It's not lost on me that in some European countries and other places like Singapore, where it's single-payer healthcare. You do not take out your credit card. It's single-payer, but private companies provide more of the services, and there's competition between the privates to deliver the services in the public system. Do you think we should be doing that here?
I've been a spokesperson for the past 28 years. So, of course, we want better efficiency, and sometimes competition might help. I'm just wondering and want to make sure that in a couple of years, if we allow private to come in as much as some people would want it to come, if we're going to be stuck with nothing left for public system. I agree with efficient public system, and until then, how about having private? I mean, you have the Villa Medica here, readaptation hospitals, private, but paid by the state for care that they do to patients who are admitted there. The walls are private, but the employees are with the same unions. And I'm hearing that it's much more efficient than in a lot of other places.
Paul, let me read you a text message here from a listener who writes that two of my siblings were diagnosed with Parkinson's in recent years. Once they received referrals from their family doctors, it was a very short wait to be seen by neurologists who specialize in Parkinson's. Okay, so I should point out for this author, Rachel Reed, she lives in a very rural area of Nova Scotia. She says that's part of it too, that there's not access, great access where she lives. So I just wonder on that side of things, maybe the situation in Quebec is a little bit better when it comes to specialists, and I wonder if what you see as the weaknesses when it comes to waiting lists in our current system.
Listen, I'm not an expert. I'm just saying that it's not normal that so many people are waiting to see a specialist. So many people are waiting to see a healthcare provider. We need to become more efficient, specifically in terms of this illness this lady was talking about. I'm not aware, that of what would be the solution, but certainly that in generally speaking, we need to have better access. What I know and what we know is that if you're, in a life or death situation, you will be taken care of rapidly. But after that, good luck if you need to be, seen by a doctor or another health professionals in a while. That's the challenge that patients incur, as I'm told that anyway.
Paul, thanks very much for coming on today. It's always great to chat with you. I appreciate it.
Thank you.
That's Paul Brunet. He's president of the Quebec Council for Patients' Rights.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.